can identify polycystic ovarian ovaries, and then ovarian cysts. And I was about saying that we can actually know how to identify all the proper nomenclature so that we don't just wake up and say simple or complex ovarian cysts. There's nothing like that. Just by looking at this, we know that this is a simple cystadenoma, and then there is a correct terminology to identify or to describe this. So I'm hoping that those are the things we'll be able to deal with as we carry out scans. We can see pathology like endometriomas. Again, based on pattern recognition, we have the IOTA nomenclature on this. Then we can have physiologic, we can have cysts that are hemorrhagic, and depending on the phase of the clot activity, we may have different pictures of it. Now, again, this is what looks like a dermoid cyst. Pattern recognition, we can easily identify this. Some call this the truffle sign, or like a paper that came out of Nigeria calling it the Akarabol sign. So again, we may have different pictures of this. So again, when we see this, we're able to identify or describe them by the correct terminology. We have IOTA terminology, so benign or malignant features. So these are just for us to know that all of this exists. Now, an ectopic pregnancy is the diagnosis, correct, is a life-saving one, and we should be able to easily identify. We can see here, we have endometrium, sorry, this is poorly spelt, and then a gestational sac here on the left adnexum. We can see the ring of fire sign. And then, so those are basic things. So in summary, we should, at the end of this training, by pattern recognition, you should be able to at least see fibroids, identify adenomyosis, polycystic ovaries, ovarian cysts, and then we should be able to, maybe during the advanced class, we'll talk about more about how to identify certain structures. So let's just talk very briefly about advanced gynae ultrasound. We're able to we're able to get detailed assessment of the female pelvis. And you notice we said by appropriately trained specialists. So this information is used to improve patient counseling and plan treatment. So because of better equipment and specialists, we have more advanced gynae ultrasound being carried out. We can do fertility assessment. I think in the last 1 week, I think I did 3 sono HSGs, and you can use either gel or water. And sometimes, like this is using gel sonography. And this is a beautiful image from this is not my image, but this is how sometimes you can see the tubes out. You can evaluate uterine anomalies. You can tell, okay, is it a septate, a biconduit uterus? And studies have shown that this has similar sensitivity and specificity to MRI at a cheaper price. You can identify things like missing IUDs. This particular patient came with abdominal pain. She was scheduled for an appendectomy. For whatever reason, the doctor sent her for a scan. And during the scan, I noticed that the IUD arm was actually burrowing through the right side of the uterus, right myometrium. So when she had this taken away, the pain went. There was no need for an appendectomy because that pain in the right iliac fossa was based on this. Again, this is another displaced IUD. And then we can see things again, just to see the potential of ultrasound. Pelvic floor ultrasound. This patient was referred to me by one of our profs, Prof. Kashima. This patient was having incontinence of fetus post-delivery, and she had a turbulent labor. Now, if you look at this image here, you could see the levator ani in red. And if you look at this side, you see how it is attached to the transverse perineal muscle. See here, everything is fine here. But if you look to the right, you can see that here you have this muscle group torn. So you know now that when you are going to do surgery, based on this image, you just go and fix this right side. So she had the surgery, this was fixed, and then continence was restored. So pelvic floor is important. You can see anal sphincters. These are things that are easy to see. For example, this is a patient that had endometriosis, advanced endometriosis. You can see that you don't have any sliding. This, like I said, please, this is talking about potential. You see how the ovary is moving with the uterus. There's no sliding organ sign. You can see an endometrioma here on the left. And even when you evaluate further, this patient has advanced disease. So for endometriosis, it's not just the endometrioma you can see. We don't have enough time. We would have shared image of the proper endometriosis deposits, and then you would see other things like the effect on the bowel, things like the Indian headdress sign. So in conclusion, ultrasound is at the center of many decisions in gynecology. It's a user-dependent technique. Training is important. With more training, we'll get a greater experience. And then if you have a good quality machine, it's very, very important. So the best way to learn to scan, make the diagnosis, reinforce the findings by being present during surgery. And this quote, I find it very useful. The most important thing about education is appetite. So the aim of this lecture is to whet your appetite, to know that there's a lot of potential with ultrasound and pursue it. Thank you very much. So I'm happy to entertain questions if there are any. Thank you.